The wedding invitation sat on my kitchen counter, embossed gold lettering announcing my sister Caroline's marriage. Black tie. RSVP by June 1st. The date, June 15th. The same date as my scheduled spinal fusion surgery. I called my mother from the surgeon's office, still holding the consent forms. Mom, I need to talk to you about the wedding date. Isn't it perfect? Caroline's been planning for 18 months. Mom, my surgery is June 15th. Oh. Your back thing. My spinal fusion. 3 vertebrae. 6 to 8 hour procedure. Can't you reschedule? This is Caroline's wedding, honey. She's been dreaming about this day since she was little. The surgeon says we can't wait. The herniated discs are compressing my spinal cord. If I wait, I could have permanent nerve damage. Sweetheart, you've had back pain for years. A few more months won't hurt. Caroline's only getting married once. Mom, this isn't just back pain. I can barely walk. I'm losing sensation in my left leg. You're always so dramatic. Remember when you thought you had appendicitis in college? That was appendicitis. I had emergency surgery. After 3 doctors. She sighed. Look, I'm not saying your health isn't important, but it's just a small procedure. Can't you do it outpatient? Reschedule for the following week. It's major spinal surgery, Mom. I'll be in the hospital for 4 days, then months of recovery. I really need to go. We're finalizing the seating chart. Think about rescheduling, okay? She hung up. I stared at the consent forms. Spinal fusion wasn't small. It was major surgery with significant risks. Nerve damage, infection, chronic pain. My neurosurgeon, Dr. Elizabeth Hayes, had explained everything carefully. The herniated discs at L4-L5-S1 had progressed beyond conservative treatment. Without surgery, I was looking at potential paralysis. But my family had decided it was minor. Inconvenient. Something that could wait. What they didn't know was that I wasn't just any hospital employee. I was Megan Foster, Director of Patient Safety at St. Catherine's Medical Center. I reported to the CEO and sat on the board's quality committee. The same hospital where my father, Dr. Robert Foster, held surgical privileges as an orthopedic surgeon. The same hospital where my mother, Linda Foster, worked as Director of Volunteer Services. The same hospital where Dr. Elizabeth Hayes was Chief of Neurosurgery and Hospital Medical Board President. I had the surgery on June 15th as scheduled. Caroline's wedding went on without me. My best friend Julie drove me to the hospital at 5 a.m. and stayed through the procedure. Dr. Hayes found more damage than imaging showed. What should have been 3 levels became 4. The surgery took 9 hours. When I woke in the ICU, immobilized and in extraordinary pain, Julie was there. You made it. Dr. Hayes said it went well, but it was more extensive than expected. Pie family. My voice was hoarse. Julie's expression darkened. Your mother called the ICU around hour 5. Asked if you were done because she needed to know if anyone should save you a plate from the reception. I closed my eyes. Your father called around hour 7. Told the nurse 9 hours seemed excessive for routine back surgery, and implied Dr. Hayes was padding the procedure time. He said that. The charge nurse documented it. I spent 6 days in the hospital. The pain was extraordinary. I had drains, a catheter, medications that made me nauseous. Physical therapy started day 2, teaching me how to move without bending my fused spine. Julie visited daily. My co-workers sent flowers. The CEO stopped by personally. My family sent one text on day 4. Hope recovery is going well. Wedding was beautiful. You missed an amazing time. Caroline looked stunning. No questions about surgery. No apology. Just a reminder of what I'd missed. Dr. Hayes visited twice daily. On day 5, she said carefully, Megan, the calls from your parents during surgery were documented and flagged by our nursing staff. I know. Julie told me. As medical board president, I'm required to review concerning incidents. Your father's accusation that I was padding surgical time, made without medical basis during complex spinal fusion, is a serious allegation. Dr. Hayes, please don't. Let me finish. Your mother's call asking about saving you a reception plate while you were in hour 5 of major surgery shows profound lack of understanding. These aren't just insensitive comments, Megan. Your father is a surgeon with privileges here. Your mother works in hospital leadership. They should understand what major surgery entails. They think I was being dramatic. You had a 4-level spinal fusion that took 9 hours. You're looking at 6 months of recovery. There is nothing dramatic about that. She paused. The medical board meeting is next week. Your case, specifically the family interactions during surgery, is on the agenda. I was discharged on day 6 with a walker, back brace and pain medication. Julie drove me home and stayed 3 days helping me navigate tasks that suddenly seemed impossible. My family didn't visit. They sent another text on day 8. Caroline's back from honeymoon. Had the most amazing time in Bora Bora. When you're feeling better we should all get together. When I was feeling better. As if I'd had a cold. The hospital gala was scheduled 3 weeks after surgery. It was the hospital's biggest annual fundraiser, attended by all board members, major donors and hospital leadership. I'd helped plan it in my role as Director of Patient Safety. I wasn't planning to go. I was still using a walker, still in significant pain. But then Dr. Hayes called. Megan, I know you're recovering but I'd like you to attend the gala if you're physically able. There's something I need to do and I'd like you there. What kind of something? The medical board made a decision about your father's privileges. I'd like to announce it publicly with you present, so your family understands the full context. You're taking away his privileges? The board determined that a surgeon who doesn't understand the difference between routine and complex procedures, who accuses colleagues of billing fraud without evidence, and who shows callous disregard for a family member's major surgery poses a risk to patient safety. Dr. Hayes. You didn't cause this. Your father caused this with his behavior. But I want you there so your family can see there are consequences when medical professionals fail to uphold basic standards. I went to the gala. Julie helped me get dressed, a long gown that hid my back brace. She drove me and helped me navigate with my walker. The room was stunning. I spotted my family immediately, my parents and Caroline with her husband at a prominent table near the front. My mother saw me and her eyes went wide. They both stared as I made my way slowly to a table where my colleagues sat. The gala proceeded through dinner and speeches. Then Dr. Hayes took the podium. Before we conclude, I need to address a matter of hospital policy and medical ethics. Her voice carried clearly. As medical board president, I ensure all physicians uphold the highest standards of medical care, professional conduct and patient compassion. The room quieted. 3 weeks ago, I performed a complex 4-level spinal fusion on a young woman whose herniated discs were compressing her spinal cord. The surgery took 9 hours. It was one of the most technically challenging procedures I've performed this year. I saw my parents exchange uncomfortable looks. During that surgery, the patient's father, a surgeon with privileges at this hospital, called questioning why it was taking so long. He implied I was padding the surgical time for billing. He suggested it should have been routine and quick. Gasps rippled through the room. The patient's mother, who works in hospital administration, called during hour 5 to ask if anyone should save the patient a plate from a wedding reception. More gasps. My mother's face went pale. That patient is Megan Foster, our Director of Patient Safety. Dr. Hayes gestured toward me. Megan, could you stand please? With Julie's help, I stood slowly, leaning on my walker. 200 faces turned toward me. Megan had emergency spinal fusion to prevent paralysis. She's facing 6 months of recovery. She was alone during surgery because her family prioritized a wedding. And during that surgery her father, Dr. Robert Foster, questioned my medical judgment and implied fraud. Dr. Hayes's expression was steel. The medical board has voted unanimously to suspend Dr. Foster's surgical privileges pending completion of remedial training in patient communication, medical ethics and surgical standards. Additionally, Linda Foster's volunteer position has been terminated as her behavior demonstrated fundamental lack of understanding about patient care. The room erupted in whispers. My father had half risen, his face red. My mother was crying. We hold our medical staff to high standards, Dr. Hayes continued. We expect them to understand complex procedures, to trust colleagues' judgment, and to treat all patients, including family, with dignity. Dr. Foster failed on all counts. She paused. Megan Foster serves this hospital with excellence. She deserved better from her family. The medical board has ensured there are consequences when medical professionals fail to meet basic standards. The room was silent. My father stood and walked out, his face dark with rage. My mother followed, sobbing. "That was incredible," Julie whispered. "I know. How do you feel?" I thought about 6 days alone in the hospital. About 9 hours of surgery my family dismissed as minor. About months of recovery ahead. "I feel free," I said. My father's privileges were suspended for 6 months. His practice suffered. My mother lost her hospital position. Caroline didn't speak to me for 8 months. But I recovered. Slowly, painfully, but steadily. Dr. Hayes became a mentor and friend. A year later, I stood at another gala, without a walker, without a brace, without pain. I'd been promoted to vice president of quality. Dr. Hayes found me during cocktails. "How's the spine?" "Good. Strong. Cleared for everything." "And your family?" "Haven't spoken since the gala. They sent messages demanding apologies. I deleted them." "Good. You deserve better." My phone buzzed. A text from my mother. "Megan, enough time has passed. We're family. Let's move forward." I showed it to Dr. Hayes. Notice she didn't apologize. I noticed. I deleted the message. Some bridges stay burned. They called my surgery minor. They'd left me alone for a bridal shower. They'd questioned my surgeon during 9 hours of surgery to save me from paralysis. Then the hospital board president stood and told 200 people exactly what they'd done. Some families learn. Some don't. Mine didn't. But I survived anyway.